Hey guys, Dr. Joel Miller here. We're talking about estrogen dominance. Now, estrogen dominance is a huge piece when it comes to hormonal health with females. And this issue is not super commonly known by our standard healthcare medical system, but it's underlying so many hormonal issues with women, and it's really important. If you're familiar with estrogen dominance, then this video I think will be really helpful for you to help explain basically what causes these types of issues and how to fix them, how to address them naturally and allow your body to heal itself. If you're not familiar with estrogen dominance, then pay very close attention, because if you have any kind of hormonal imbalance, then you might find this video to be extremely helpful. Again, estrogen dominance issues are at the root of so many different problems when it comes to female hormones, and it's important to kind of understand what this means, what causes it, and then we can talk about how to reverse these issues. So let's get into it a little bit. Estrogen dominance, what is it? I'll direct your attention here to the left. It's a functional condition where estrogen is higher in relation to progesterone. That's very important to understand that. Estrogen and progesterone ought to be functioning together at very similar levels. Whenever estrogen becomes higher in relation to progesterone, we're going to have issues. Now, you could have a normal level of estrogen, but low progesterone, you have estrogen dominance. And likewise, if you have normal progesterone but high estrogen, you could have estrogen dominance. Now, estrogen dominance is going to result in a lot of these symptoms we're seeing here on the right. Irregular periods, PMS symptoms, so if you get a lot of heavy bleeding with your period, if you get a lot of cramping or pain, headaches or irritability leading up to your period, migraines would also be included in that category, then you likely have estrogen dominance issues. If you have uterine fibroids, that's usually a estrogen dominance issue. Cysts in the breast is a estrogen dominance issue, primarily low progesterone, but we'll get into that a little bit more here in a second. Infertility is largely going back to estrogen dominance issues. Now, on the right here, out of all these signs and symptoms, if you have these symptoms, 90 to 99% of the time, you have estrogen dominance issues. Now, sometimes irregular periods could be caused by something else in regards to hormones called PCOS, slightly different condition. Sometimes things with infertility can be due to anatomical issues and things like that, or even, the health of the sperm can impact that as well. So, but again, at large, the estrogen dominance is underlying the majority, if not all, of these issues if you're experiencing these things. Now, diagnosis-wise, we use signs and symptoms. We can do that, or lab testing. Signs and symptoms are definitely an easy way to kind of spot these things. So for women that come in and they have different hormonal imbalances and they tell me how they get a migraine a few days before every period, I know they have estrogen dominance. If they're telling me about infertility, and obviously with infertility, there's other things you want to look at. You want to look at blood sugar, you want to look at thyroid health. And at times it's really good to look at the anatomy of things as well, make sure all the anatomy is functioning well. But I see a lot of different infertility issues, and a lot of times it goes back to the estrogen dominant stuff. So signs and symptoms: if someone has heavy bleeding, I know they've got some estrogen dominance issues. Uterine fibroids, cysts in the breast, estrogen dominance issues. Now, the way that you would undergo diagnosing this as far as lab testing goes is you can do blood work to check estrogen, to check progesterone and the different metabolites there. I personally don't think that's super accurate. I don't think it's the best way to go. Out of all the ways with testing, number one, the signs and symptoms is huge. Number two, for diagnosing as far as lab tests go, I like to use the Dutch hormone test. That's dried urine test, and it gives you a massive panel that breaks down all the hormones and their metabolites. Can be very helpful. And then, of course, I like to use the functional neurology, the muscle testing with the applied kinesiology as well, to figure out more specifically what types of hormones are at play here, what imbalances are at play, and what's needed to fix these issues. So a little bit more on that later. So what is estrogen dominance? So we talked about how it's a functional condition where estrogen is higher in relation to progesterone. So let's go through this a little bit. As I mentioned, you can have high estrogen, low progesterone. That leads to estrogen dominance, or that is estrogen dominance. You can have high estrogen, but progesterone is good, estrogen dominance. You could have good estrogen where it's not toxically high, and low progesterone, you still have estrogen dominance. So all of these different scenarios are going to lead to estrogen dominance. And it's important to understand exactly what's going on with your case specifically so that we know which part we need to address. I would say the overwhelming majority of women are going to have high estrogen and low progesterone. They're going to have the mix of both worlds here. So it's usually very uncommon for women to just have one of these things being off, but you know, I have seen it. So let's keep moving here. What causes these high estrogens? High estrogen or estrogen toxicities are going to be caused by all of these things here. I would say gut dysbiosis is probably the number one thing. Things like bacteria, parasites, fungus, candida, all these different infections result in your gut and your body creating different high levels of toxic estrogens, and that will cause all these different hormonal imbalances and lead to estrogen dominance. So when I'm working with a patient, we're figuring out their infertility issues, we're figuring out what's going on with their hormones. Number one, okay, we have to check for high estrogens. We figure out what's needed to help detox those. Then we have to figure out what's causing that issue in the first place. Usually it goes back to gut infections. A lot of times it can be related to inflammation, which is kind of a big, broad term, right? That could be related to nutrition. That could be related to other, infections, toxicities, a number of different things. High stress hormones, cortisol is the main stress hormone we're talking about here. That can lead to high estrogen issues. If you're taking birth control, you have high estrogen. You have estrogen dominance issues already because of the body's poor ability to detox these things. Poor detoxification in the liver. You could have normal hormone levels, but essentially if your liver is not able to detox them out well, then that can obviously build up and lead to other issues. Excessive fat tissue. Fat cells are known as estrogen factories. So if you have excess weight, maybe around your hips, maybe around your belly, that could actually lead to some excess or high estrogen levels and cause estrogen dominance. So it's really important to consider that in when looking at all these hormones. Exogenous or xenoestrogens. These are basically estrogens that, or let me say it differently. These are basically different chemicals, different things that we're exposed to that act like estrogens in our body. So this next point here, excessive soy intake. Soy is considered a xenoestrogen. It acts like estrogen in our body. Plastics act like estrogens in our body. So if we are eating food, especially warm food, out of plastic dishes, we're getting a high dose of these xenoestrogens, and that can throw off our hormones. So you really want to be careful with the plastics. You want to be careful with the synthetic hormones that are oftentimes added to lotions, actually. A lot of times lotions have a lot of different chemicals, and sometimes they even have added synthetic hormones in there as part of the way that different companies will try to help lotions to just make you feel better. So all of these different issues, this is what leads to high estrogens. You want to look at all these, consider if any of these issues might be driving your estrogen, and it's going to be very important for balancing your hormones, not only now, but long-term, and keeping balanced hormones throughout the rest of your life. So what causes low progesterone? Well, I would say the number one thing, all of these things, but the number one thing is probably going to be high stress hormones. The cortisol shunt is primarily what I'm getting at with this. In your body, our cells can take progesterone and turn it into cortisol. This happens for women when they're in a stressed or fight or flight state, and their body, their adrenal glands are trying to constantly push out cortisol, and over time they can seemingly get ran down. Well, what happens is your body will literally convert your progesterone into cortisol to keep you going, to keep you alive. So If you have high stress hormones and cortisol issues, that's a very, very big thing that can run down your progesterone and lead to estrogen dominance issues. B2 deficiencies can also lead to low progesterone issues. As you see the next point, B3 deficiencies can as well. B2 and B3 are needed to make progesterone. So if you have any kind of hormonal imbalances, if you have any kind of estrogen dominance issues, and low progesterone is a big player there, you got to look at B2 and B3 deficiencies. Now, B3 is one that you can easily supplement with. I like to use niacinamide from Thorne. It's a very good product. B2 deficiencies, though, are usually going to happen due to things like infections in the gut or inflammation. So if you have any kind of gut issues, bloating, gas, and that kind of thing, you definitely want to address those with herbs and get on top of those with herbs and nutrition in order to get your vitamin B2 back. You do not want to supplement in those cases because that will make the infection worse and lead to more hormonal imbalances. Inflammation is a big piece too. And again, inflammation is going to drive the cortisol issues, making things worse. Anemias is also a big issue with low progesterone. If your cells don't have enough oxygen, you're not going to be able to convert your cholesterol into pregnenolone. So cholesterol turns into something called pregnenolone, which is the precursor to progesterone. So number one, let's actually jump to the bottom here. If you have low cholesterol, you're not going to be able to make pregnenolone, and then you're not going to be able to make progesterone. So you've got to have good, healthy fats in your nutrition, in your diet. Things like grass-fed beef, things like grass-fed butter, things like coconut oil, olive oil, sesame seed oil, unrefined, untoasted sesame seed oil, fish, eggs. All these things are going to be really, really healthy to get healthy forms of cholesterol in order to make your hormones. Now, back to the anemias. If you have poor oxygenation of your cells, your body actually won't turn the cholesterol into the pregnenolone, and thus you'll be deficient in progesterone. Now, a lot of times when people hear anemias or anemic issues, they think of low iron. Iron is a big one, but there's also some other really big ones. B6 in the activated form is called P5P. It's very, very important, and a lot of women with hormonal imbalances are deficient in this B6, P5P. B2, obviously we talked about that one a little bit. B9, folic acid is really, really important, and folate specifically. We want to get, as far as supplements go, we'll talk about that here in a second, but with B9, you want to get the methylated form generally, and that's going to be 5-MTHF is what we call that. We'll talk about that more in a second. B12 is also really important here. So if you have a deficiency in any of these things, that's going to make it difficult for your body to make progesterone. Now, I mentioned a second ago the B2 deficiency will be low due to gut infections. Iron is also a nutrient that different infections will feed on, as well as B12. So if you have deficiencies in B2, B12, or iron, chances are you have some kind of infection, some kind of gut infection potentially, whether that's bacterial, fungal, or parasitic, and you need to address that in order to get these nutrients back. Supplementing is only going to drive that issue to become worse over time. So, all right, so we've talked about estrogen, we've talked about progesterone, we've talked about what causes these issues. Let's talk about how to fix these issues. Let's talk about how to reverse it. So obviously, number one, we've got to detox the estrogens, and we've got to address the underlying root causes of the estrogen toxicities. Simultaneously, we've got to support the progesterone, and we've got to address the underlying root causes of the low progesterone. So how do we go about that? Well, let's start with the estrogen issues. Number one, what's going to help detox the estrogens? So there's something called, in the liver, there's two pathways that help detox estrogens. One pathway is called the cystine pathway, and another pathway is called the glucuronic acid pathway. Now, artichoke contains a lot of glucuronic acid. A lot of women, therefore, will benefit a lot with supplementing with an artichoke supplement. Yes, we're talking about artichoke, the food, but again, as I mentioned before, in situations like this, when it comes to artichoke, a supplement is usually going to be necessary because you're usually not going to be able to get that much artichoke in, at least as much as you need, simply through the food. So artichoke is going to be really good to help detox estrogens. And then the other nutrients I'd say is just going to be nutrients that support methylation. So things like the 5-MTHF. So that can be really helpful. That's activated B9. That can be helpful for detoxing things. Things like B6, specifically the active form P5P. Magnesium, specifically magnesium citrate or glycinate. I don't really see people need significant amounts of other types of magnesium. It's usually citrate or glycinate. Zinc. Zinc is very, very important as well for balancing out these hormones, and oftentimes can be a key nutrient missing that can help detox these estrogens. Choline, which is found in the yolk of eggs. You can also get it in supplemental form. TMG, trimethylglycine, found in beets, can be very good. And then B12. Now, I mentioned earlier again, the B12 can be low due to infections, and so you definitely want to check that out if that's what's going on. So keep in mind that when we talk about balancing out these hormones, when we talk about different supplements and different nutrients that may be helpful for you, not every nutrient on this list is going to fix your estrogen toxicity issue. It's different for every single person. That's why it's really, really important to, if you're able, to work with a holistic doctor that does some form of functional neurology, some form of muscle testing. My recommendation is always to work with a doctor that does systems healthcare. Just a wonderful technique that's really able to specifically and precisely get to the bottom of these different issues, and figure out exactly what's needed to detox these estrogens and so forth. So these are some nutrients that can detox the estrogens. We talked about the different root causes that will lead to these estrogen toxicities. It's really important to address those as well. And for help with some of those things, I definitely recommend checking out other videos, other posts, asking questions. Would love to help in any way I can with that. So next, let's get to progesterone. We've got to support progesterone. We talked about the underlying root causes. We've got to address those as well. So if you have a gut infection, if you have some kind of gut infection that's leading to a B2 deficiency, maybe an iron deficiency, you've got to address that. You've got to address those gut infections. If you have inflammation, if you have cortisol issues, you've got to address those issues in order for your body to actually be able to make its own progesterone and build that up. So what are some other things you can do, some other nutrients that you can do to support progesterone? I would say riboflavin B2, we talked about that. You've got to address the gut infections if those are there. Niacinamide B3, that one's very safe to supplement with and generally needed, especially for women that have been on any kind of medications. B3 can be helpful with detoxing those through the liver and helpful for getting that progesterone back. Iodines actually can be really, really helpful for women with low progesterone issues. What iodine does is it supports your thyroid system. Iodine and a healthy thyroid system is actually going to not necessarily increase your progesterone levels overall, but it's going to increase what we call progesterone sensitivity. So what that means is, how sensitive are your cells to taking in the progesterone into your cells? And when we increase the thyroid health, when we support the thyroid health and add in iodine, that can often improve cellular sensitivity to progesterone, to where now the progesterone that's in your blood, your cells are actually taking it in and using it. So iodine, it can increase progesterone sensitivity. Next, we have the anemic-related nutrients, right? So we're talking about the B6, P5P, we're talking about 5-MTHF, molybdenum. All of those can be very helpful. And then, of course, iron and B12, you got to make sure that if you have a deficiency in those, that you are getting to the bottom of it and figuring out if there's an infection or not, and what that looks like. Now, again, with all of these are general recommendations for what can help detox estrogen, what can help support progesterone, and then again, just kind of the root causes that underlie a lot of these different issues. I hope this is helpful for you, and definitely, I want to encourage you, as always, to reach out and ask questions if you have any. I always recommend, again, with this, to work with a functional doctor that can actually precisely figure out these issues with you and for you, and help you balance your hormones as soon and as quick as possible. So any questions, let me know. So I believe we're at the end here. So let's connect. Guys, you can jump online. You can schedule a free phone consult if you like, schedule your first visit. I'm here in Dallas, Texas, and seeing patients often with these hormonal issues, helping them figure it out, helping balance these things out. Hormones can be really, really difficult, really challenging, and being able to have a holistic approach is really, really helpful. Find us online at the different social medias. Find us online at drjoelmiller.com, and definitely reach out if you have any questions. Again, I'll encourage you that, these estrogen dominance issues are really, really common, but they're also really simple as far as being able to reverse them and being able to heal from them. So I want to encourage you that it is possible. It's a lot more simple than you might think if you can understand and grasp a lot of the things that we've talked about here. Understanding, hey, where are these different imbalances coming from? And then, starting to address those can be kind of another story, but also very important. All right, guys, I hope this has been helpful for you. I've got some more videos coming. Definitely let me know if you have any questions on these things. Let me know if there's anything else you'd like me to talk about. Check out the podcast. Check out things on Instagram. Guys, I hope this has been a blessing to you, and hope that we can get those hormones balanced as soon as possible. We'll see you guys in the next one.